Hello, my name is Jacob Avila, and in this video, I'm going to be comparing a few different ultrasound devices, specifically looking at the handheld category. We are going to be comparing Vave Health's phased array transducer with the butterfly transducer. Now, full disclosure, I am a consultant for Vave Health, and because of that, I'm not going to talk about the pros and cons of each image. I'm just going to show you the images, and you can kind of figure out what the pros and cons of each of those are. The first one I'm going to show you is an apical 4-chamber view. Not the best views, but great for comparison. Here is a subxiphoid view of the same normal heart. Let's move on to the abdomen. This is a left upper quadrant view, looking for maybe free fluid, maybe hydro. We got the butterfly on the left and the Vave Health probe on the right. The previous examples were all normal. Now let's look at some abnormals. This is a parasternal long axis view with a RVOT here and here that is quite enlarged. This is an apical 4-chamber view of the same enlarged right ventricle. This is some lungs. We have pleura here, trying to find B-lines, not really finding a whole lot. Now with this one, I was able to get one of our cart-based machines, which is a Mindray TE7 for comparison there. Here is a pleural effusion seen with the butterfly on the left and the Vave Health transducer on the right. And here we have a quite abnormal heart. We have a parasternal long axis view. It is showing the left atrium, here mitral valve, left ventricle, aortic valve, right ventricular outflow tract, and we have a couple of pathologies here. If you look under here, there is a pretty decent sized pericardial effusion, and then look at this little flappy thing right here. This is an incompetent aortic valve. We can compare that with the Mindray TE7 over there on the right side of the image. Here's that same patient, but a parasternal short axis view. And we compare that to the cart-based TE7 machine. And lastly, this is a bowel obstruction with some free fluid, or rather high-grade obstruction, seen with the butterfly and the Vave Health probe, compared to the Mindray machine. So that's it as far as my comparisons. Hopefully that was helpful. And remember, there's not a one-size-fits-all probe. Depending on how you work, what the billing situation is, the local practices in your institution, one probe might be great for you and not so great for somebody else. Feel free to reach out on the emails or on the Twitters if you have any more questions or comments. Thanks.